Hi, welcome back. I'm Dr. Diamond, an OBGYN and someone who lives with PCOS. If you haven't watched the first video, that one talks all about what PCOS is and why it matters. And here we're going to talk about what causes PCOS. So I'll be honest with you, we don't really know. But we do know a lot about how it affects the body, how we can fix it, how we can help it, and a lot about how we can work with your body instead of against it. Always remember though, this video is for educational purposes and is not meant to be construed as medical advice. I always recommend you work with your doctor so that you get the best diagnosis and care. So, what is the cause of PCOS? Well, I wish it was a simple answer, but it's not. It's complex. And it's really not just one thing, it's actually a puzzle of hormones, metabolism, genetics. So, let's work through some of the most common theories. The science tells us that are most strongly linked to PCOS. So, the first thing that we know is associated with PCOS is that insulin resistance plays a big role. We're going to get a lot into insulin resistance in this video series. That's one of the main things we're going to focus on because that's something you have the ability to make big changes on. So what is insulin resistance? Insulin, first of all, is a hormone that helps your body use sugar from your food. With insulin resistance, however, your body is making insulin, but your cells in your body don't really listen very well to the signals that the insulin is trying to send. So in response, your body makes more and more and more insulin trying to get the job done. And in doing so, this extra insulin can affect a lot of things. It can affect your testosterone levels. It can affect your periods. It can make it harder to lose weight. It can impact your risk of diabetes, cholesterol, heart issues. You can think of insulin as a storm cloud. This insulin resistance is a storm cloud that hangs over everything. It doesn't cause PCOS by itself, but it makes everything worse. Okay? So the genetics that is associated with PCOS is not so clear cut, but we do know that PCOS does run in families. We haven't found a PCOS gene, and it's unlikely that it's a single gene, although we do think that it is several genes altogether that combined with lifestyle and environmental factors contribute. That means that if your mom, your aunt, your sister had PCOS, that you might be at higher risk for it too. But again, it's not your fault. This means that the deck was stacked against you, and that doesn't mean you can't do anything about it. This is not about how your body works. It's not about anything that you've done wrong. Another component is environment. We don't really have proof that any one chemical or food causes PCOS, but we do know that things in your environment, such as stress, such as poor sleep, obviously your diet, lack of exercise, and even exposure to certain hormone disrupting chemicals could make PCOS symptoms worse. That's why when we focus on changing lifestyle, we want to focus on the things in your environment. All of those things together, eating differently, managing stress, it can all help. It's not about fixing you, it's about giving your body the tools that it needs to function better. So, what about weight? Let's talk about that carefully. Not everyone with PCOS is overweight. So it's not everyone who needs to lose weight. But if you do carry extra weight, especially around the belly, that can worsen insulin resistance, which worsens hormones like testosterone. So it's like a circle. Insulin resistance, weight gain, hormone imbalance, making it hard to lose weight, insulin resistance, and back again. But here's the helpful part. Even small changes, specifically if you lose 5 or even 10% of your body weight, can lead to a huge improvement in your cycles, your hormones, and your energy, and fertility. This is not about shaming you and your body. Body shame is not part of my approach to PCOS, but I do want you to understand your body's unique chemistry and how we can work with your body. You probably noticed by now, though, that PCOS can look like a lot of things. That's why your doctor needs to work with you to rule out other causes before we actually call it PCOS. So sometimes that could be a thyroid issue. It could be a hormone called prolactin. It could be something with your adrenal gland. It could be something called Cushing syndrome. It could be even a tumor. Usually that's pretty rare. Usually it's benign, but possible. So this is one of the most important reasons why this video series is here to help you and educate you, but you still need to work with your doctor. You can't diagnose yourself over the internet. So let's do a check-in. Let's come back to your motivation that we talked about in the first video. Ask yourself again, on a scale of 1 to 10, how motivated are you to learn and manage your PCOS? Maybe your number is still a 3, but maybe it's higher now. So I would ask you, why not a lower number, and figure out the why for that question and use that as your spark. Because if it's making sure you're fit enough to get pregnant, fit enough, healthy enough to prevent chronic illnesses like diabetes or high blood pressure, or simply about just feeling better about yourself, regulating your periods. There's so many reasons. I want you to just know that I need you to believe that change is possible and you can do this. So what's next? Now that we've talked about what might cause PCOS, the next step is to learn what you can do about it. We're going to start talking about nutrition, movement, lifestyle, fasting, supplements, medications, all of these things. In the next video, we're going to talk about weight and why it's not the only thing that matters, but it is integral to managing PCOS. We're going to learn how to support your hormones through diet and how food and exercise can affect insulin and not just your size. Remember, you didn't cause your PCOS, but you can learn how to support your body. And that starts with information and not fear. So thank you so much for watching. I'll see you in the next one.